Pregnancy can trigger it. Men and women who stand or sit for prolonged periods of time are most susceptible to it. Vein disease strikes 1 in 5 Americans, and most people don't even know they have it because the symptoms can seem so insignificant. Vein disease begins within your circulatory system. 60 to 70% of blood volume in the entire body is located in the veins. When blood circulates up through leg veins toward the heart, gravity forces the veins to work harder. The calf muscle, or second heart, aids the movement by contracting and relaxing as a person walks. This pressure causes the valves within veins to open and close, thus moving blood upward. Poor circulation interrupts this flow, causing blood to back up or pool in leg veins. Blood flow irregularity can cause swelling and, if left untreated, more serious vein disorders.
Symptoms of venous disease can include unsightliness, leg pain, which can be described as discomfort, throbbing, aching, tiredness, itching, leg swelling. Venous disease complaints are oftentimes overlooked because they're very common complaints. They can be minor to major. Unfortunately, patients oftentimes underappreciate the symptoms, do not communicate that to their physicians, and even the medical community will underappreciate some of the complaints that people have with venous disease.
Ignoring these symptoms often results in what many of us know as spider veins and varicose veins. Over time, they become more and more painful and embarrassing for the person afflicted with them, which ultimately affects your quality of life.
I would have to sit down every 15 minutes, every 30 minutes, something like that if I was walking. I really noticed when I went to Disney World with my family, like I just couldn't walk. It was really strange. It was like, I'm used to just going all the time, but after half an hour, I just had to sit down because it was just so aching to me.
I first noticed some varicose veins with my first pregnancy. I noticed some puffiness and discomfort, some swelling in my legs, and I thought maybe that they would go away after pregnancy, but they didn't. They just kind of lingered, and then with my next 2 pregnancies, they continued to get worse, and I just decided that, I needed to do something to try to help my legs feel better, to not ache so much, and to alleviate some of the discomfort that I was having.
Prevention and treatment is actually easier than many people think. A simple change of socks or hosiery can drastically reduce the discomfort of swollen ankles and tired, achy legs. Known as graduated compression socks or pantyhose, they are inconspicuous yet play a vital role in promoting proper circulation.
Medical compression stockings work by providing external pressure, greatest at the ankle, and reducing that compression as you go up the leg. This creates or improves blood velocity and blood circulation and reduces swelling and the feeling of fatigue at the end of the day.
Finding the right fit is important. For optimal effects with over-the-counter graduated compression socks, select your pairs by shoe size and measure your ankle circumference to get the best results. For medical prescriptions, patients should consult with their doctor and be fitted by a certified Sigvaris fitter to ensure optimal results.
I was told that even after my pregnancies that they may go away, but knowing my family history, I know there was no way that they would go away on their own. The compression hose, they did help me quite a bit. I was instructed by my doctor to wear them during my pregnancies and even after pregnancy.
It kind of alleviated the pain. I am not used to wearing those types of socks because, well, I'm a guy. But the thigh-high socks, it just kind of pushed everything together and it just allowed the blood to flow back up, and I felt that relief. It wasn't a dead pain or kind of a dead feeling in your legs like I used to have.
Sigvaris graduated compression socks work to alleviate and eliminate the symptoms of vein disease that can cause varicose and spider veins. Who knew that a simple change of socks could greatly improve your quality of life? But it's true. Sigvaris graduated compression socks and hosiery work to increase blood circulation back to the heart and can lessen the need for surgery or other expensive and invasive treatments.
They do so by improving the vein blood flow, by keeping areas of varicose veins compressed, and by preventing swelling during the course of the day, and effectively counteracting those symptoms. They can improve the activity of patients during the day.
Sigvaris has a unique sizing system that fits 97% of the population in an off-the-shelf, ready-to-wear socks and stockings that have significant medical benefits along with fashion and comfort options such as cotton socks for people with sensitive skin, sheer hosiery that is elegant and therapeutic, and flat seam socks with diabetic-friendly features. The industry has changed because the lifestyles of people, for business people, for occupational people, for people who work in office situations, their lifestyle changes are such that they want to look good throughout the day, but have the stockings not look like medical stockings.
They're very fashionable. They make all different colors, different styles, knee high, thigh high. They try to accommodate you, I think, the best that they can.
It's like medicine that you wear, so join the millions of people who are finding relief in the form of a sock. To find out where you can get a pair of Sigvaris compression socks, log on to sigvarisusa.com to locate a certified retailer in your area today.